Hello everyone, welcome to this short tutorial from Pathology made simple at ilovepathology.com. This is the part 2 of pneumoconiosis. In the part 1, we had discussed about the general aspects of pneumoconiosis and in detail about the co-workers pneumoconiosis, right? So in this part, we will be discussing in detail about another important pneumoconiosis, that is silicosis. Now we will see what is the pathogenesis of silicosis, the spectrum of disease, the morphological aspects, the clinical features and complications. Now before we understand the concept of silicosis, let us see what is silica. Silica is the compound of two most abundant elements in the Earth's crust, that is silicon and oxygen. This is in the form of silicon dioxide. Remember, silica comprises around 59% of the Earth's crust. Now we need to understand what are all the high risk occupations where this silica is exposed to individuals. The first one is foundry worker. So this is basically the job of melting metal, where they melt the metal, they pour that molten metal into a mold and then form a metal casting. Now here the workers use sand to make these castings, that is where they are exposed, into which the molten metal is poured. So they use sand enormously to make these castings. The second important occupation which is relevant to silicosis is sand blasting. Now what do they do? This is also called as abrasive blasting. What do they do is they forcibly propel a stream of abrasive material, here in this case the sand, against a surface under very high pressure, and by doing so it smoothens the rough surface. So these individuals who are involved in sand blasting are exposed to silica. Unless they wear proper masks, they are very highly vulnerable to silicosis. The third one is hard rock mining. Now we need to understand that hard rock constitutes around 100% silica. So people who are exposed to this form of occupation are very highly vulnerable to silicosis. And lastly, stone cutting. Again, this fine dust which comes out of the stone during the cutting process, individuals are exposed to silicosis. So these are the main occupations which are having a very high risk factor for development of silicosis. Now silica, we need to understand that there are two forms. One is crystalline form, another is amorphous form. Amorphous is basically a non-crystalline form. So crystalline forms are different types. One is quartz, cristobalite and tridiamite. Amorphous, as I told you, this is non-crystalline form. So this is the crystalline form of silica. This is a higher magnification of a crystalline form of silica, and this is a non-crystalline form. This is basically a powder form. So why should we know whether the silica is crystalline or amorphous? Because pathogenetically it is important, because crystalline forms are more fibrogenic, whereas non-crystalline forms are less toxic and less fibrogenic. Now we shall see what is silicosis. So silicosis is a lung disease attributed to inhalation of crystalline silicon dioxide, that is the silica. Remember, we learned that there are two forms, right? Crystalline and amorphous. So exposure or inhalation of crystalline silicon dioxide causes silicosis. Crystalline is very important here because crystalline forms are pro-inflammatory, and silicosis is the most common occupational lung disease worldwide. Estimated around 1 million workers are exposed to high levels of silica. Because of use of air handling equipment and face masks, the incidence of silicosis nowadays has been substantially reduced. Now what is the pathogenesis of silicosis? Once these individuals inhale the crystalline form of silica, so this is a crystalline form of silica, it enters the alveoli, that's an alveolar macrophage. So what do? There will be interaction between the epithelial cells and the macrophages by this crystalline form of silica. And once that happens, there is activation of inflammasome, and from the macrophages, there will be release of mediators. Okay, so due to release of various mediators like interleukin 1, interleukin 18, tumor necrosis factor, fibronectin, lipid mediators, oxygen-derived free radicals and fibrogenic cytokines. So they stimulate the proliferation of fibroblasts, and that results in deposition of collagen. So remember, crystalline silica is extremely fibrogenic. So as I told you, the oxygen-derived free radicals which are released, they can directly damage the epithelial cells, okay, alveolar epithelial cells, and can cause parenchymal damage. Another important thing we need to understand is that the silica kills macrophages. How do they kill? After ingestion by the macrophages, the silicon hydroxide groups on the particle's surface, they form hydrogen bonds with phospholipids and proteins, and that damages cellular membrane of the macrophage. So that's how the macrophages are killed, and because the macrophages are killed, the silica within the macrophage is released along with fibrogenic factors. Okay, so free silica again is ingested by other macrophages nearby, and this process continues and it is amplified. Now, what is the final outcome? Final outcome is something like this. This is called silicotic nodule. Now, what is a silicotic nodule? This is basically composed of bundles of interlacing collagen in the center, surrounded by a minimal inflammatory reaction, along with the presence of other inflammatory cells like, the macrophages, the fibroblasts, and these macrophages can be seen with ingested silica particle, that is dust laden macrophages. So this is the end result of silicosis, that is formation of fibrotic nodules, are also called as silicotic nodules. Now, the pathology of silicosis, it is based on the chronicity, it is based on the incubation time and the level of exposure. So based on this, the silicosis is categorized into chronic or classical silicosis, accelerated silicosis and acute silicosis. The chronic form is the most common one. It takes around 20 or more years of exposure where there will be presence of silicotic nodules in the lung parenchyma. That is a hallmark of chronic or classical silicosis. The silicotic nodules initially develops in the hilar lymph nodes, okay, and then they calcify. And because of calcification on radiological examination, they look like, eggshell calcification, which is characteristic finding in silicosis. So the disease progresses to fibrosis of the upper lobe in classical silicosis. Accelerated silicosis is similar to classical silicosis. Only thing is that the exposure is heavy and the duration of exposure is less than that of classical silicosis. Here it is around 5 to 10 years, and pathologically you find the presence of silicotic nodules. Acute silicosis, on the other hand, it results due to heavy exposure over a very short period to high levels of silica of small particle size, particularly crystalline forms of silica, and the silicotic nodules in this case is very poorly formed or sometimes even be absent. Okay, so this form of silicosis, that is acute silicosis, mimic pulmonary alveolar proteinosis. Now, what are the clinical features? Clinical features, initially, because this is a restrictive lung disease, because of formation of extensive fibrosis in the parenchyma, it manifests with features of restrictive lung disease, that is dyspnea. Initially with exercise, they might present with cough with or without sputum production. They can present with wheezing or chest tightness, which finally can lead to respiratory failure. So what are all the X-ray findings of uncomplicated silicosis? Initially, there will be enlargement of hilar lymph nodes, which basically precede the parenchymal disease. Uncomplicated silicosis has a very small round opacities in the radiological as a radiological feature. If you find a eggshell type of calcification as described earlier, and that is a very suggestive of silicosis. Occasionally, this can calcify. So this is what you see in the chest X-ray as the round opacities of the hilar lymph node. Periphery of these opacities, because of calcification, you can find thin rim of denser opacity, which looks like that of an eggshell. That's why it is called as eggshell calcification. Morphologically, the gross features include, initially there will be pale nodules in the upper lobe of lung. Sometimes these nodules can be pigmented if the coal dust is also present. Okay, the nodules can be black in color, and these nodules, these smaller nodules, progresses to form a very large hard collagenous mass in the advanced stage of silicosis. So initially it will be in the form of pale smaller nodules, and finally at the end stage you can find this advanced stage where it is a hard collagenous mass. Because of either because of ischemia or because of secondary infection, these masses can undergo cavitation. Microscopically, this is a feature. Classical feature is finding of concentric layers of hyalinized collagen, and the periphery is by presence of dust-laden macrophages. Now, what are the complications of silicosis? The most important complication is susceptibility to tuberculosis. It could be either Mycobacterium tuberculosis or atypical mycobacteria when it is called as silicotuberculosis. The rate of tuberculosis range from 5 to 43% in cases of association with silicosis. Now, why is that silicosis is susceptible to tuberculosis? Remember, I talked about silica damaging macrophages, right? So these damaged macrophages, because of the damage, the ability of these macrophages to kill mycobacteria is hampered, and that's why they are more prone for development of silicosis. So the factors which may influence is the stage of silicosis, the type of the disease. For example, acute silicosis have a very high risk of development of tuberculosis. Now, what are all the other complications? The first one being cor pulmonale. Cor pulmonale meaning there will be enlargement of the right side of the heart because of the pressure of the pulmonary circulation, right? Pulmonary vessels. That's because of extensive fibrosis of the lung parenchyma. The second one is spontaneous pneumothorax. Because of massive fibrosis, there will be development of emphysematous bullae, and sometimes these bullae can rupture, resulting in spontaneous pneumothorax. Silicosis can initiate, autoimmune type of autoimmune diseases, particularly a collagen vascular disease. So silicosis can induce a type of collagen vascular disease called scleroderma, because we know that this is more fibrogenic, right? Lastly, silicosis is associated with lung cancer. So how do you treat silicosis? There is no way you can treat silicosis. There is no specific treatment for silicosis. All you can do is only supportive therapy. Okay, treat if you have symptoms. The treatment only can reduce the symptomatology of silicosis. It cannot reduce the progression of the disease unless and until you prevent the further exposure of silica. And how do you do that? Proper masking. That is the only way you can prevent these occupational lung diseases. Thank you. So that's all about silicosis. If you have liked this video, hit the like button. Do comment if you have any questions. Don't forget to subscribe, and please do share if you find this video helpful. Thank you.